Imagine you're looking at a majestic horse, pregnant, seemingly robust, radiating health. You might think horse pregnancies are pretty straightforward, a natural process that just kind of unfolds. But there's a specific biological challenge that veterinarians universally consider a true emergency, a twinning catastrophe, they call it. It's a situation where the inherent vulnerability of even this powerful animal really comes through.
It's true. Yeah. Today we're diving deep into equine twin pregnancy. Unlike many other species, mares are, well, physiologically adapted for singleton pregnancies.
Yeah.
Just one. That makes twin gestations inherently high risk, like right from the very start.
And our mission today isn't just to tell you what happens in these scenarios. We want to uncover the surprising biological why behind this crisis, revealing those critical moments and decisions that can, well, make or break a breeding season. We'll explore why this is such a profound challenge, who's most at risk, the really dire consequences if these pregnancies go unmanaged, the absolutely critical importance of early detection, the various management strategies available, and, finally, how to prevent it altogether. This deep dive should give you a clear, concise understanding, providing key insights into the crucial decisions in equine reproductive management. Okay, let's unpack this. Where do we start?
Well, the core biological truth here is that a mare's uterus and placenta are physiologically designed to support only one fetus to full term. Think of it like a perfectly sized single-bedroom apartment, maybe. And unlike many other species where the placenta might attach in just a few specific spots, a mare's placenta is more like this giant full-coverage Velcro sheet lining the entire uterus.
A Velcro sheet, okay.
Yeah, so when two fetuses are present, these two Velcro sheets are basically forced to compete for that same limited surface area and resources across the entire uterine wall.
So it's not just about two bodies trying to fit in one space. It's really about the vital efficiency, the nutrient and oxygen transfer being compromised.
Precisely. That's exactly it. This competition leads to what veterinarians call placental insufficiency. Imagine trying to share one small garden hose between two really thirsty plants. Neither gets enough water to truly thrive. That's essentially what happens with nourishment and oxygen for two fetuses and a mare. This shared placenta just can't deliver enough for both. This makes twin gestation an inherently high-risk event and, frankly, a significant biological aberration for the mare.
Well, and historically, before we had modern technique.
Historically, unmanaged twin gestations were a primary cause of non-infectious abortion, accounting for as high as 38.6% of abortions between 5 and 9 months of gestation. That's huge. And even if twins were carried to term, the foals were often non-viable or severely compromised. Just not healthy.
It's staggering to think almost 40% of non-infectious abortions could be tied back to this one issue. The economic implications must be massive for breeders, potentially devastating for entire operations.
They absolutely are, yeah. Unmanaged twin pregnancies often lead to mares being barren for an entire breeding season. That means substantial direct financial losses from missed foaling opportunities, plus all the associated breeding costs wasted. And beyond that, complications like dystocia, that's a difficult birth, or retained placentas, and then the intensive care needed for compromised twin foals. It all means high veterinary expenses. Very high. And, the long-term health and athletic potential of any surviving twins are often diminished, so their market value takes a hit, too. It's also worth noting that a missed twin diagnosis is actually a common cause of veterinary malpractice claims. Adds another layer of significant risk.
So given these really severe consequences, who exactly is most susceptible to this unique biological challenge? We know natural twin births are remarkably low, only about 1 to 2% of pregnancies. But you mentioned twinning disproportionately causes pregnancy loss up to 30% of all abortions. So what stands out when we look at who's at risk?
What's fascinating here is the clear evidence of a genetic predisposition. It really seems to run in certain lines. Twinning varies significantly by breed. Thoroughbreds and draft-type horses, for instance, they have higher multiple ovulation rates. We're talking 15 to 25% for thoroughbreds and about 24% for draft horses.
Okay, that's quite high.
It is. Now, contrast that with, say, quarter horses, ponies, and Arabians. Their rates are much lower, 8 to 10% for quarter horses, maybe 2 to 3% for domestic ponies, and actually 0% recorded for Korean wild ponies. It's a stark difference, which strongly suggests a genetic component.
Wow, 0%. That is a stark difference between breeds. It makes me wonder, are there other individual factors that increase risk? Does a mare's age play a role here?
Yes, a significant one. A mare's age directly correlates with increased multiple ovulation rates. It goes up over time. For example, mares aged 4 to 7 years might have a 2.8% twinning rate, but this rises to 6.8% for mares aged 16-20 years. It more than doubles. Older mares, particularly those 6 years or older, show an 18% multiple ovulation rate compared to just 14% in younger mares. This escalating risk means older mares absolutely need more intensive monitoring during breeding.
Right, okay. So it sounds like past performance is also a predictor. If a mare's had twins before, she's more likely to have them again.
That's right, yeah. Mares with previous twin pregnancies are significantly more likely to have another one. Also, the highest incidence is actually seen in barren mares, those not currently foaling, then maiden mares, and then lactating mares. And while stallion fertility is mainly about conception rates, highly fertile stallions are correlated with increased twin incidences. It's likely because they're just more efficient at fertilizing multiple ovis if they're present.
Okay, that makes sense.
And the pattern of ovulation is crucial too. This is interesting. About 77% of twin pregnancies originate from bilateral ovulations, meaning one egg from each ovary. That's compared to 60% from unilateral ovulations, where both eggs come from the same ovary. It's that bilateral ovulation, one from each side, that often sets the stage for a more challenging twin pregnancy to manage later on.
That's a really interesting detail about the ovulation pattern. What about common drugs used in breeding, the ones that induce ovulation? Can they inadvertently contribute to this problem?
They certainly can, yeah. Medications like dislauryl acetate, often sold as Oviplant, and human chorionic gonadotropin, or HCG, they're used to induce ovulation, make breeding more predictable. But they can also increase twin rates. Studies have shown twin rates around 19.7% for dislaurin, 14.8% for HCG, versus maybe 11.8% in untreated mares. So while they boost overall pregnancy rates, they can inadvertently stimulate multiple ovulations.
So a known side effect, basically.
Pretty much, though interestingly, comprehensive studies suggest the season doesn't play a major role in the overall twin probability. That seems to be less of a factor.
Okay, so if these twin pregnancies go unmanaged, what happens then? What are the dire consequences we talked about? How does that single-bedroom apartment analogy play out in reality for both the mare and the foal?
Right. This brings us back to that core problem, placental insufficiency. It's the root of it all. The mare's uterus is designed for a single fetus. So when two conceptuses are present, they compete fiercely. Finite space, finite resources. This invariably leads to insufficient development of both placentas, which compromises both fetuses even before birth. It's just a fundamental biological mismatch.
And the risks to the mare herself sound pretty severe, potentially even life-threatening.
They absolutely are. Unmanaged twin pregnancies are the leading cause of abortion in mares. Like we said, accounting for up to 38.6% of non-infectious abortions between 5 and 9 months. This often results in the mare being barren for the next breeding season, a huge loss. If both fetuses are somehow carried close to term, there's a greatly increased risk of dystocia, that difficult birth. Dystocia can lead to uterine tears or even rupture of major arteries, causing fatal hemorrhage for the mare.
No way.
Yeah. And even post-foaling, assuming she survives, there's a higher incidence of retained placenta, and that can cause severe laminitis, a really painful and debilitating condition of the hooves. Plus, all this physical trauma and stress can lead to difficulty in rebreeding. It might cause temporary or even permanent infertility.
It really sounds like a terrible cascade of complications. If they do somehow make it to term, are the foals? Are they okay? Are they viable?
Unfortunately, generally no. Foals born from unmanaged twin pregnancies are frequently smaller, underdeveloped, inherently weak. It's all because of that competitive intrauterine environment. They just haven't had enough. This leads to high non-viability and neonatal mortality rates. Many just don't survive birth or the first few days. Surviving twins, they have a higher risk of severe illnesses like septicemia because their immune systems are compromised. And maybe more importantly for breeders, they have a less than average chance of maturing into full-sized, healthy, usable horses. Athletic potential is often reduced. Also, dystocia itself means prolonged labor, and that can cause oxygen deprivation, hypoxia, which can lead to severe neurological damage or death for the foals. It's a truly tragic outcome. It really underscores why this is a twinning catastrophe.
Yeah, it's crystal clear why early intervention isn't just an option, but a fundamental welfare and economic imperative, as you put it.
So if the consequences are so dire, early detection must be absolutely paramount. Is there a golden window for diagnosis that vets aim for? There truly is, yes. Timely and accurate detection is the absolute cornerstone of successful management. It is considered essential for a veterinarian to examine a pregnant mare within the first month of conception, like really early.
Hmm.
Delaying diagnosis dramatically reduces the efficacy of reduction procedures and definitely increases the risks involved.
And the gold standard for this detection is transrectal ultrasonography, right? The ultrasound. When exactly is the absolute best time for that first scan?
Yes. Ultrasound is the most critical diagnostic tool we have for this. The optimal timing for that first scan is between days 9 and 15 post-ovulation. This window is key. We call this the mobility phase, and it's absolutely crucial because at this stage, the tiny embryonic vesicles are still free-floating within the uterus. Think of them like little bubbles just drifting around in the uterine fluid.
Okay, so they haven't attached yet.
Exactly. This mobility allows the vet to easily separate them, identify two distinct ones, and then gently crush just one without disturbing the other. This makes it the safest and most effective window for intervention. The vesicle can be seen really early, like 9–10 days, typically 14–20 millimeters by day 14 or 15. And crucially, natural reduction, where one just disappears on its own, is negligible during this specific period, so you can't rely on that happening then. Intervention is key.
Got it. So that's when you really want to catch it. What happens next? Is one scan enough, or do you need follow-ups?
A second scan is highly recommended, usually around days 25 to 30 post-ovulation. This is primarily for heartbeat confirmation. By day 25, a fetal heartbeat should be clearly detectable on the ultrasound. This scan confirms viability that the remaining embryo is developing properly, and it also serves as a crucial recheck. Did we miss one earlier? Was the reduction successful? Plus, if a singleton is confirmed at this stage and then, unfortunately, is lost later, the mare may still be able to be bred again in the same season, which is a huge benefit for the breeder.
Right, salvage the season, potentially.
Exactly. Then, day 45 and/or day 60 scans are also pretty common. These later scans confirm normal fetal development is continuing, and here's a crucial point. After day 40, special structures called endometrial cups form in the uterus. If the mare aborts after these cups have formed, she often won't return to estrus, won't cycle back, meaning she could lose the entire breeding season. That's a critical financial consideration.
That makes sense. Okay, what about the challenge of differentiating an actual embryo from, say, a uterine cyst on the ultrasound? I imagine that could cause some confusion, especially for someone less experienced.
That's a common diagnostic challenge for sure, especially for a less experienced eye or maybe with older equipment. But veterinary professionals are trained to distinguish them. They look for the embryo's characteristic spherical shape. Its motility within the uterus, remember, it's still free-floating early on, and its consistent, predictable linear growth rate. Embryos grow day by day. A cyst, in contrast, is usually static. It doesn't grow like an embryo, and it certainly doesn't move around.
Okay, so key differences to look for. What about hormonal blood tests? Are they helpful at all for detecting twins specifically? Could a breeder just rely on those instead of ultrasound?
Not really for specific twin detection. They have significant limitations there. Hormonal assays like equine chorionic, gonadotropin, or ECG that's produced after day 40, and estrone sulfate, which is produced much later, after day 60 or even 150, they're generally unreliable for identifying individual fetuses or assessing their specific viability. For example, ECG levels can sometimes stay high even after fetal death, so you could get a false positive thinking there's a viable pregnancy when there isn't. Their main use is really just confirming the presence of a pregnancy, not its nature, singleton versus twin, or the number of conceptuses. They simply aren't precise enough for twin management. Ultrasound is king here.
Got it. Ultrasound is the way to go. Beyond the hormones, what other factors might complicate an accurate diagnosis, even with ultrasound?
Well, definitely the operator's experience level matters a lot. It takes practice to get good at reading those images. The quality of the ultrasound equipment itself makes a difference too. Better resolution helps. And, as we just discussed, the presence of multiple uterine cysts can sometimes muddy the waters a bit, making it harder to be certain you're seeing embryos. This all just emphasizes again why that golden window between days, say, 13 and 15 is so critical, because the manual reduction technique used then is safest and most effective, and maybe requires a tiny bit less precision than some later stage interventions.
Okay, so let's say we've diagnosed twins, ideally in that golden window. What are the primary strategies for twin reduction? Where do vets start?
The preferred method, the one with the best track record by far, is pre-fixation manual reduction, done specifically between days 13 and 15, sometimes up to 16. This involves the vet performing transrectal manipulations, so gently guiding things through the rectal wall and carefully crushing one embryonic vesicle. All while the embryos are still mobile, still those little floating bubbles within the uterus. Typically, the vet will choose the smaller vesicle, or the one that's easier to access, to minimize manipulation and maximize the chances for the remaining one.
And the success rate for that method, it sounds pretty quick and effective.
It boasts a remarkably high success rate, honestly, often exceeding 90% in achieving a single viable pregnancy that goes to term. It's considered quick, relatively painless for the mare, and carries minimal risk to her or the remaining pregnancy. It really is the ideal scenario.
90% is fantastic. Now, I've also heard about natural reduction. Does that happen often enough that maybe you could just wait and see if one disappears on its own?
That's a common question. Natural reduction, where one embryo is spontaneously eliminated by the mare's body, does occur. Overall, maybe in about 64% of term pregnancies. But it's highly dependent on location. The rates are significantly higher, up to 87.5%, some studies show, when both twins fixate unilaterally, meaning they implant in the same uterine horn.
Ah, so they're competing directly in the same space.
Exactly. In those cases, the larger, more dominant vesicle can often competitively deprive the smaller one of resources, leading to its demise. However, natural reduction for bicornual twins, where there's one in each uterine horn, that does not typically occur at all. They have their own space, essentially. So while it's possible to wait and hope for natural reduction in those unilateral cases, it carries the significant risk of missing that crucial golden window for manual crushing. If you wait too long and natural reduction doesn't happen, you're then forced into more invasive, riskier, later stage techniques. It's generally considered a gamble that most careful breeders and vets won't take.
Right, better to intervene when it's safest and most effective. Which brings us to those post-fixation reduction techniques. These are for when that early diagnosis is missed, or maybe manual crushing wasn't possible for some reason. What are the common methods then, and what are the trade-offs?
Exactly. These techniques come into play generally beyond day 16, once the embryos have fixed or attached to the uterine wall. And you're right, they generally come with lower success rates and higher associated risks for both the mare and the remaining fetus. One common technique is transvaginal ultrasound-guided aspiration, or TUA, sometimes called 2GR twin ultrasound-guided reduction. This involves aspirating the fluid from one embryonic vesicle or sometimes directly stabbing the embryo or fetus itself. It's all done using a specialized probe inserted through the vagina, guided very precisely by ultrasound, like a highly targeted cleanup inside the mare.
Okay, when can TUA be performed, and what's the success rate like?
TUA is typically performed between 16 and 70 days of gestation, but it's much more favorable, much more successful before day 35. Success rates then are maybe 40–57%, still decent, but not the 90% plus of manual crushing. After day 40, the success rate can drop significantly, sometimes even to 0% as the fetus gets larger and more established. Complications can include uterine irritation or inflammation, especially if the operator isn't highly experienced. There's also a potential risk of infection, so prophylactic antibiotics are usually given, and of course, sedation complications for the mare are always a possibility.
Okay, so still an option, but definitely more complex. What other options are there for even later stage reduction? It sounds like they get progressively more invasive.
They do, unfortunately. Another technique is craniocervical dislocation, or CCD. This is typically performed quite a bit later, between 60 and 110 days of gestation. It involves the vet manually dislocating the craniocervical junction, basically, the neck of one fetus. This can sometimes be done via rectal manipulation, similar to the early crushing, but obviously much harder with a larger fetus. Or, in some cases, it might require a flank laparotomy, which is abdominal surgery.
Wow, okay.
Yeah. The goal here is to cause the demise of one fetus, allowing the remaining one to hopefully utilize the entire endometrial surface and grow normally. One study reported about 64% of mares undergoing CCD ended up with a single normal-sized foal at term. But that also means about 36% aborted both conceptuses following the procedure. So still significant risk of total pregnancy loss.
Right. And then the most invasive one you mentioned earlier, fetal heart injection. That sounds pretty serious.
It is, yeah. This is usually reserved for even later stages, typically between 90 and 130 days, so well into the second trimester. It's a highly invasive method where a toxic agent, something like procaine penicillin G or sometimes potassium chloride, is injected directly into the heart of one fetus. This is done under transabdominal ultrasound guidance, meaning the needle goes through the mare's abdominal wall. While approximately 50% of these procedures might result in a single fetus carried to term, it's associated with a significant incidence of foals born with in utero growth retardation. They just didn't have optimal conditions even after the reduction.
So even if it works in terms of getting a live foal, there can be long-term health or development issues for that surviving foal. That's a tough consideration. What about supportive medical management during all these procedures? Is it just about the physical intervention, or is there medication involved too?
Oh, medical management is absolutely indispensable. It's not just about the physical act. Non-steroidal anti-inflammatory drugs, NSAIDs like flunixin, meglumin, most people know it as Banamine, are almost always given. Their main purpose is to counteract prostaglandin release, which is naturally triggered by uterine manipulation and can cause uterine contractions and pregnancy loss. They also help minimize inflammation. Also, progestins are very commonly used. Things like injectable progesterone or the oral form altrenagist, often sold as Regimate. These hormones help maintain the pregnancy, keep the uterus quiet.
Okay, so supporting the remaining pregnancy.
Exactly. But there's an important note here. When using these exogenous progestins, it's crucial to monitor carefully for retained dead fetuses, because the progestins can prevent the mare's body from naturally expelling a fetus that has died, which could lead to severe uterine infection or other complications for the mare. So follow-up checks are vital.
Right, makes sense. It really sounds like there's a critical trade-off at play in the whole decision-making process for twin reduction. The earlier you catch it, the simpler, safer, and more effective the solution is.
Precisely. That sums it up perfectly. As gestational age increases, the success rates of reduction techniques decline, and the risks to the mare, to the remaining fetus, to the whole pregnancy, they just climb higher and higher. Skilled physical intervention plus that targeted pharmacological support are what optimize outcomes. But the choice of which physical technique you can even use is almost entirely dictated by how early the diagnosis is made. It all comes back to emphasizing that golden window once again.
So looking at the big picture, what are the ultimate outcomes and prognosis for these managed pregnancies compared to if they're just left alone? Is all this effort and intervention truly worth it in the end?
Oh, absolutely. The difference is night and day. Mares undergoing some form of reduction generally have about an 80% live foal rate overall. Now, that's only slightly lower than the maybe 87% live foal rate you'd expect for mares that conceived a natural singleton pregnancy right from the start. So it gets them pretty close. And when you look at the specific techniques, yes, the success varies. TUA maybe 33-49% live foal rate, fetal heart injection around 50%, CCD around 64%. But compare that to unmanaged twins, where the outcome is almost always abortion of both or birth of severely compromised, often non-viable foals. These numbers clearly highlight that intervention significantly improves the chances for a live, healthy foal.
Okay, so a huge improvement over doing nothing. What factors most influence these success rates beyond just the specific technique chosen and the timing?
Mare age is definitely a big one we already touched on. Older mares, particularly those over 9 or maybe especially over 15 years, are statistically more likely to lose the entire pregnancy even after a successful reduction attempt. Their systems are just less resilient. The gestational day of the reduction is probably the most influential factor overall. Earlier is just significantly better. Operator experience, of course, makes a difference, especially with the more technical procedures. Any concurrent health issues the mare might have can play a role. And even things like the twin location, remember, unilateral versus bicornual, and the size disparity between the twins can influence success. For example, unilateral fixation, where one twin is clearly larger, like a 4 millimeter plus size difference early on, actually increases the success rate of natural or manual reduction.
Interesting. And what about the health and long-term viability of the foals that do result from managed pregnancies? Is it just about getting a live birth, or is the quality of survival the real goal here?
It's absolutely about the quality of survival. That's the term vets often use. The objective isn't just a live foal, it's a single healthy foal that can reach its full genetic potential, whether that's racing, showing, or breeding. Early reduction techniques, especially manual crushing before day 16, or even CCD later on if done well, generally result in normal-sized, healthy foals indistinguishable from singletons. However, as we noted, those later-stage interventions, particularly fetal heart injection, are associated with that significant incidence of in utero growth retardation. That can impact the foal's long-term health, its growth, its soundness, and ultimately its athletic potential or value. So yes, we're aiming for a sound, healthy, competitive animal, not just a live birth, and certainly not a foal that requires extensive ongoing medical care just to survive.
So when we compare managed versus unmanaged twin pregnancies, it really sounds like there's just a stark contrast between a potentially devastating outcome and a genuinely successful one if handled correctly and early.
There is a monumental difference, yeah. Early management dramatically reduces overall pregnancy loss, full stop. And it avoids those severe detrimental outcomes associated with unmanaged twinning, which again, predominantly result in the loss of both conceptuses or severely compromised foals that often don't make it. This really solidifies the clinical imperative for proactive twin management, as the literature often states. It effectively turns what would be a near certain catastrophe into a highly manageable situation with a good prognosis.
Okay, that makes perfect sense. Given all these challenges and the importance of early intervention, what about preventive breeding practices? Can we actually avoid twinning in the first place, or at least minimize the risk significantly? Maybe looking at the bigger picture of herd management?
Proactive management is absolutely key, and yes, it really begins long before conception even happens. Thorough pre-breeding examinations and very careful ovulation monitoring are essential, especially for mares known to be at higher risk. This means routine ultrasound scans, maybe every other day, or even daily as ovulation approaches during the mare's heat cycle. You're monitoring follicular size, how the follicles feel, the status of the cervix, uterine tone, all to precisely define the timing of ovulation. And for mares with unknown or maybe poor reproductive histories, a more comprehensive evaluation, things like uterine culture, cytology, maybe even a biopsy, should ideally be done well in advance of the breeding season.
So knowing exactly when that mare is going to ovulate is crucial, partly to avoid fertilizing multiple eggs if she happens to release more than one.
Exactly. Careful timing of insemination is critical. The goal is usually to inseminate within the 36 hours before ovulation and up to the actual time of ovulation. This timing optimizes the chances of singleton conception by having viable sperm ready for the egg, but hopefully not lingering too long if a second ovulation occurs much later. It helps avoid fertilizing multiple ovas. Then, even with all that care beforehand, early and repeated pregnancy checks are simply non-negotiable. They are standard practice in well-managed programs. All bred mares should undergo ultrasonographic examinations, specifically looking for twins, especially around day 14 post-breeding. And then again, as we discussed, around day 28 or 30 to confirm viability and catch anything missed. Even if multiple ovulation wasn't suspected, you still check.
Right, diligence pays off. What about the mare's general health and diet? Do those play a role in prevention too?
Absolutely. Good overall health is always beneficial. Nutritional and environmental management do play a role. Maintaining an ideal body condition score, usually a 5 or 6 on the 9-point scale for brood mares, is important. Not too thin, not too fat. Providing good quality forage, like legume hays, alfalfa, clover, can be beneficial. And critically, avoiding fescue grass, especially endophyte-infected fescue, is important. Those fungal endophytes can cause a host of reproductive problems, including prolonged gestation and placental issues, which would only compound problems if twins were present. Basically, a healthy mare in good condition is generally better equipped to handle any pregnancy, singleton or otherwise, and might even have slightly more regular ovulation patterns.
So, if there's one overarching principle from all these preventive measures and risk factors,
Yeah.
what would it be for breeders who really want to avoid this catastrophe altogether, maybe even thinking long term, over generations?
I think the overarching principle is really knowing your mare, knowing her history, and acting early and decisively based on that knowledge and good veterinary diagnostics. The understanding that twinning is repeatable within the same mare, meaning she's likely to do it again, and that it exhibits a degree of heritability, meaning it can be passed down genetically. This allows for strategic breeding decisions. On an individual level, this might include being extra vigilant with mares known to twin, or potentially even deciding not to breed a mare with a history of recurrent unmanageable twinning. On a broader herd level, it could involve developing genetic selection programs over generations to gradually reduce the predisposition to multiple ovulations within a breed or a specific line. It's really about moving from purely reactive crisis management, dealing with twins after they occur, to proactive, informed prevention for the health of individual animals and the economic sustainability of breeding programs.
This has been a truly comprehensive deep dive into equine twin pregnancies. Really fascinating stuff. So, to recap the absolute key points, equine twin pregnancy is a serious biologically challenging issue, fundamentally because the mare's unique physiology is inherently adapted for singleton gestations. Just one foal.
Exactly. And early detection via ultrasound, particularly within that golden window of days 9 to 15 post-ovulation, is paramount. That allows for the most successful and lowest risk intervention, which is manual reduction, leading to the best possible outcomes. Remember that analogy of the Velcro sheet placenta limiting resources and the free-floating bubbles of those early embryos? It's all about catching them during that brief window of opportunity before they attach.
Right. And while later stage interventions do exist, we've heard they are definitely more invasive, generally less successful, and carry significantly greater risks to both the mare and the foal's long-term health and viability. So proactive breeding management, careful monitoring, Timed insemination, early checks, and understanding those genetic predispositions are vital for prevention. It's about shifting from reaction to foresight.
It really is. And, the incredible precision and the level of extensive intervention involved in managing equine twin pregnancies, it's driven by both animal welfare concerns and significant economic considerations. It truly highlights a fascinating intersection of advanced veterinary science and the profound value, both emotional and financial, that we place on these animals.
Which leads to maybe a final thought for you, our listener, to ponder. What is this deep commitment we see here, this focus on ensuring quality of survival over mere existence for these foals? What does that tell us about our evolving relationship with the animals we breed and care for? And perhaps, how might similar, highly tailored, proactive approaches redefine success in other areas of life where biology presents inherent limitations or challenges? Something to think about.